In this research rundown, it's a little out of the ordinary because it's not actually research as much as it is practice, and what doctors and medical professionals that formed a group called the Frontline COVID-19 Critical Care Alliance have put together in dealing with vaccine injuries. Now, there's no public health authority that recognizes post-COVID vaccine injuries, and so there is no specific classification code for this disease, but clearly the VAERS report is coming out and showing there's a significant number of individuals that are suffering from vaccine injuries. And so what's interesting about what they've come up with is this is their protocol for treating vaccine injuries. And one of the things that you find in it is, there's the typical approach to dealing with COVID-19 itself, like ivermectin, vitamin C, vitamin D, that sort of thing. But what I'm pleased to see in here is that as one of their therapies, they're identifying hyperbaric oxygen as of course, a very potent anti-inflammatory therapy that can help with post-vaccine injuries. In fact, if you look through and look at most of what they're listing in their therapies, they have one thing generally in common, that is the anti-inflammatory properties that occur from taking that supplement or that drug. And so hyperbaric oxygen is sort of down the list, and the reason they're putting it down the list is they're saying logistics can be an issue and also cost can be an issue. So my recommendation is find hyperbaric oxygen because it is the most powerful anti-inflammatory, and that's what we're getting from everything else that's in here that significantly focuses on that component, which is the major component in this vaccine injury. And so see if you can find a clinic, find the opportunity to get some therapy, and clearly oxygen under pressure is going to help a great deal, and find the right cost. You can get the cost significantly down if you do your research, find these independent clinics that will provide that therapy. So that's my recommendation, and it's great to see that these frontline doctors are coming to the same conclusion. Thank you.